So I'm Rachel Tolhurst, and I'm the Research Director for the ARISE Consortium, which is a 5-year programme which focuses on improving equity and accountability for health and well-being in informal urban spaces. And we work, our core focus is in 4 countries, Bangladesh, India, Kenya, and Sierra Leone. And we have representatives from 3 of those countries here today. So ARISE is a partnership between UK universities and a range of different types of institution in our core focus countries and institutions that operate globally, such as SDI, Slum Dwellers International. So our approach to co-production is that we see we see the whole program, the hub, as co-producing knowledge. So between the different formal partners, academic partners, NGO partners, and so on. But co-production is also core to the type of research that we're doing with communities. So communities we see as the kind of core partners for co-production, the primary partners, and we are working mainly through a community-based participatory approach, CBPR, which we understand to mean that involvement of community members in every stage of the research, from planning through data collection and analysis through the use of the data, is central to producing solutions to problems that are owned by the community and build on community resources and assets and strengths. We are primarily working with co-researchers selected from the communities in various ways as our primary approach to data collection, and we're also generally using participatory research methods to widen the involvement of different community members in that process. So among the different countries, we have more or less formal. We have a bit of a variety in the extent to which that co-research team is very formal. But we do have co-researchers involved in all the communities, and we're really aiming to widen and deepen the people who are involved in the process over time.
So what usually they do, the co-researchers, whenever we want to develop tools for data collection, we develop the draft tool and we present the tool to them, and we modify the tool together, and we try to review those tools together and ensure that it actually fits the context of their communities. When we are collecting data, because we are collecting usually participatory, we are collecting data based on participatory approach. So for example, if we are doing social mapping, trying to understand how the community looks like, what are the key definitive areas within the community? What are the landmarks? What does this landmark mean? How does this landmark affect people? Which vulnerable group that are available? How does this vulnerable group are being affected by issues of health and well-being within the community? So they lead these conversations. The co-researchers lead these conversations, and we try to support them as best as possible to ensure that they are able to get through whatever agenda we have set for the day. So another thing the co-researchers do is to also take part in, the data we collect. They don't transcribe. We have transcribers. So they transcribe data. When we are doing analysis, they also take part in those analyses, not in like complex part of the analysis, but technically like going through the transcript. What are the issues coming up? What are the things that are coming up? How are these things really related to what we have discussed? Are there anything else we need to follow up on? So they go through those transcripts and we try to get these analyses done together. So in each case, we do initial briefing with them in form of teaching, in form of tutorials, in form of guiding them. And once they get the understanding and they are set to go, then we do that.
The current co-researcher team are inclusive of the different social groups that we already know to be marginalized in communities. So, for example, people with disabilities, in some contexts, sex workers in other contexts. We'll hear a bit more about that from the individual researchers.
So we didn't disclose in the team of co-researchers why somebody was chosen or why somebody was included. So sexual identity or HIV status, or they're just community members. So they don't know from each other why they were chosen or why they were asked to participate. And then the community members themselves said, we need to also include women who have sex with women, which was not in our, it's a group that we hadn't thought about. And community members said, this is a group we know very, very, very little about, and that would be very interesting to include them in data collection. So we had a focus group with them, which was really interesting. And they said they had never been invited to the Chiefs Camp for anything, whether a meeting or, so it was really much appreciation.
So in terms of social inequalities, again, those are really core to the ARISE approach because we're focused on equity, and the theoretical and practical approach that we take is one of looking at intersectional power relations. And we understand that to mean that individual positions of power and opportunities and risks are created through the intersection between multiple axes of social inequality, and that operates at multiple levels, from the macro level down to the micro personal level. And that, that's another reason that CBPR and co-production is really important to change the symbolic basis and the discursive basis for those inequalities. And also that this is a process of transferring and transferring power from professionals and researchers to communities, and transforming power relations at all levels.
How I look at ARISE project as a person, I look at it from an angle of a triangle. So I look at the community in a base on one side of the triangle and the service providers in the other one and the government at the top. And I look at our ARISE hub at the middle of that triangle. And if we focus more on reducing the gaps, then we're going to improve the lives of these communities, because there's a tendency, or there's a possibility of increasing the gap, and there's also a possibility of reducing that gap. So at any one point, I usually keep asking my colleagues in Kenya, what are we doing in that gap when we are inside?
Ways in which I've been trying to address inequities starts with the selection of co-researchers. So I have a diverse group of co-researchers. There are 5 women and 3 men. These include both service providers, but also community members who are usually not involved in research and represent marginalized groups in the community, like men who have sex with men, female sex workers, HIV positive people, and people with disability. Another way we have been thinking all through about inequities is about starting with discussion on power. how we understand power. I did that more intensively with my two Kenyan researchers, discussing the power theories, and then with the community co-researchers, also discussing that, but more from a practical point when it is about at different stages in the research. So power and recruitment, power and data collection, power and data analysis. And then we've also been taking time to form the research team with the community co-researchers, taking time to define rules, get to know each other. We often hold group reflections at the end of meetings. We learned from their experiences of research, and often they have been extractive research where they were only involved in data collection, either as data collectors or participants. And there was huge frustration about not getting to understand the findings. And so helping them to understand the whole research process was very important for us to start working together and to build partnerships and build trust. And part of that was also that we discussed expectations and risks.
Participation is a term that we use a lot in theory, but it means very, very differently when we're actually working with people, because they don't want to be only engaged with, they don't want to be only participated with, they actually want to be in partnership with the research. Now that's where I could say is an area which is very difficult to get through. So when you're on site, if you are thinking that you're going to be with them, to work with them, to collect data, so what do you do with that data is a very important question, because people across globally in our practice that we've seen are tired of being tested and are tired of being researched. And there are certain darling cities, I would say, like Nairobi and Dharavi and Mumbai, where people have been tried and tested again and again with lots of researchers coming in and going, and they just don't like it anymore. So they ask you a fundamental question saying, what are you going to do with this data?
There are challenges in terms of working with community people, in terms of working with co-researchers. Challenge in terms of getting them on speed in what do we want to do now? How do we do it fast? Do they have the knowledge? How far are they willing to do this? How far is the community ready to actually take part in all of these discussions? It's a huge challenge because the expectation of the community in terms of financial support is really huge, and you have to ensure that it is clear enough that this is what we want to do and this is what we have at this moment. But however, there are positive comments towards that. The community co-researchers really enjoy the whole process. They keep learning new ideas and new things, and they are excited that the process will continue and they can keep learning new innovations in terms of research and data collection, analysis, and report writing.
It's very interesting to have been a part of practice, to be very convinced that I knew a lot of things, to come to this side of research and then try to, take a step back and then try to now see how much I know is true, and is there new things that I didn't know about. I have, been tuned myself from being a practitioner to being a researcher. When I was practicing, I would always wonder, what is that people do not like from the research community? And I think there's a small realization that I've made is that I think it never happens that in the entire timeline or the outcome of the PhD program, that we consider that at the end of the program, how many researchers go back to the community to give a copy of the findings in the language that people are able to understand, and how many of researchers use data collection as a process to give that data back to the community in a way that is useful to them in order to make negotiations for whatever they wanted to with whosoever they wanted to. So I think these are two very important things, I feel, to talking about trust and talking about engaging and talking about partnerships.
What we've been doing to address issues is we hold regular debriefing as researchers after every activity. We have been strengthening our own capacities as researchers. So we train ourselves in conflict resolution approaches. We do counseling together to get external input on ways of doing things and reflecting on what we've been doing and what has been going well and how we can improve that, but also providing counseling opportunities to all co-researchers through our program of LVCT Health at the site. We are working a lot with diagrams and graphs instead of only verbal discussion. That helps to illustrate the content and make it more accessible and more interesting for co-researchers and participants.
So I'm Sally Thurboff from LSTM, and I've really enjoyed the discussion. Thanks everyone for the richness. I wanted to make 3 points. So the first is around context and complexity. The second is around positionality and intersectionality. And the third is about CBPR and nurturing trusting partnerships. So for the first, then we've heard about the importance of context. Smruti talked about how different Indian cities have different dynamics, and we need to think about co-production as embedded within different contexts. And we've also heard about the range of different issues that these amazing PhDs are focusing on: tenure, displacement, sexual violence, youth, WASH and children. And this is just some of the ARISE PhDs. If you go to arise.org, you can also hear from Bashira, actor from Bangladesh, Lilian Atiso from Kenya, Shrutika Murphy from India, and Abu Conte also from Sierra Leone, and see the range. So context, we need to think about context and building, trusting, co-producing relationships within context. Secondly, around positionality and intersectionality. I think all of our speakers spoke about what it means to be a researcher themselves, and we heard from Smruti about wearing different hats, activism, practice, research, and having to have that reflective lens on us and our positionality, but also when we're talking about co-production and CBPR, who are we in that researcher position, and how we need to extend those discussions around positionality and reflexivity to our co-researchers and those relationships and how they play out. And it was really good to hear from Beata and hear from Sami about the range of different co-researchers, who they are, how they've been selected, how those groups are nurtured and supported. So Beata, you talked about group reflections and debriefing, and Sami talked about support structures and guidance and getting people set to go for research. And Ivy, you talked about the valuing and the importance of engaging co-researchers across all of those different steps of the research cycle and the excitement that can come with that. And I like this idea as well of having spaces to think critically about theory and practice and power. So I think it's really important when we're looking at co-production to extend that focus on positionality and reflexivity to all the different players that are there. And then thirdly, briefly, around the challenges and the opportunities and the joy of CBPR. We've heard about the frustration of extractive processes and the frustration of people being involved in endless research that doesn't seem to come back to them, doesn't shape ongoing practice. change, and how CBPR and the relationships it nurtures, we need to think about how to build trust, how to have these difficult discussions. They may be difficult, they may not, but about ownership, about how we come together, about expectations, to have clear discussions around expectations and partnerships. And that's about trust. And as we heard from Beata and from others, it can take time. It requires a broader set of skills. And I like the focus on thinking about the skills that we need as researchers in that, in terms of capacity, and the idea also of focusing on counselling and having counselling and safe spaces available in order to work out challenges and issues as they emerge, as they will in the messy realities of real life and building those relationships. So contexts are important. Positionality, we need to think about that in a holistic way, and intersectionality brings us ideas there in terms of thinking through power. And then really the strengths and the challenges of CBPR. And Ivy, I love the idea of the triangle. And what we're doing in CBPR is trying to enhance and strengthen that circle and bring different partnerships to bear to promote accountability, to promote well-being, and to promote equity.